2 weeks into what was supposed to be a 2-week circuit breaker, things are worse. Officially, Nova Scotia is reporting 227 new cases today, but the province warned there are at least 200 more that haven't been entered into the system.
I need to be honest with you. The volume of cases has exceeded the capacity of public health.
And so, tough new restrictions. All schools are closed for the rest of the month. One person per household is allowed to do the shopping, and there's a $2,000 fine for leaving your municipality. The borders with PEI and Newfoundland and Labrador will close. Only permanent residents and people who fit a short list of exemptions are allowed in, like Alyssa Green. She's a letter carrier who crosses from New Brunswick for work.
They want to see your ID to see where you live, as if I would be lying. Like, why would I? And then, you know, you're having to go through scrutiny to get to work, and then you have to go through this big scrutiny just to get home.
Next week, the process will be even stricter. Necessary, says the province, with the virus on the attack, sending patients into ICU.
They're often, fully sedated. We have to keep them in a medically induced coma to allow the breathing machine to do that work. And oftentimes they have other organ failures as well.
Doctors expect the number of patients to keep going up over the next 10 days.
They are as sick as you can get and still be alive, basically, in the ICU.
With such a backlog in contact tracing, Statistics Canada and tracers from Newfoundland and Labrador are being called in to help. Officials warn May will be a rough ride, and it'll be worse if people can't or won't follow public health restrictions. Shayna Luck, CBC News, Halifax.